Stem cells are cells in our body that act as the building blocks that may divide and create new cells, maintain, or even repair cells, tissues, or organs in the body. There are two main categories of stem cells. Pluripotent stem cells are immature cells that can divide and change to give rise to many different cell types in the body. In contrast, adult stem cells are cells which have already fully developed or chosen a role, and these function as maintenance and repair cells. Stem cells make replacements for cells that are lost through wear, tear, injury, or disease. These functions are carried out naturally by our own bodies. The latest research shows that we may be able to use some of the same stem cells for therapeutic purposes. Currently, the only stem cell-based products that are approved for use in Australia are blood-forming stem cells from cord blood or bone marrow. This is called hematopoietic stem cell transplantation. This is a therapeutic option for some children with a select number of rare neurological disorders, such as metachromatic leukodystrophy, Krabbe syndrome, Hurler syndrome, Hunter syndrome, and X-adrenoleukodystrophy. Stem cells are also being researched to develop new therapies in the hope that they may be able to help protect vulnerable brain cells and support their function, while other cells may be able to help repair or promote natural repair. Clinical trial registries can also help you find out more about specific stem cell clinical trials in Australia, the USA, and other countries. As with any medical procedure, there may be risks associated with stem cell therapy, and not all stem cell therapies are the same. So it's important to talk to your doctor about the benefits and risks beforehand. The risks can depend on the types of stem cells being given, how they are given, such as into a vein or directly into the brain or spine, and the drugs that are used to support the therapy. While side effects may not be common, they can be serious and include infection, allergic reactions, blood clots, and the rejection of the cells by the immune system. Tumour formation, although rare, has occasionally been seen with some immature stem cell therapies. With all of this in mind, it's important to note that undergoing an experimental stem cell therapy may interfere with other treatments and disqualify you from participation in other registered clinical trials. As for the benefits of stem cell therapy, they all depend on the exact type of therapy. Possible benefits may include preventing the condition from worsening and stabilising or improving some symptoms. If you are thinking about stem cell therapy, you may like to use a checklist to help you explore the risks and benefits for your child and talk to your doctors. It's important to ask about the potential clinical benefits and risks of the therapy, the procedure, the ongoing medical care, and other considerations such as cost. Remember, always ask your healthcare professional to explain the risks and benefits.
When you're in this rare disease space and you're faced with a decision of possibly an experimental treatment, and you need to really weigh up a risk-benefit analysis, but you need to look at, well, what's my child's life like now, and what could it potentially be like if we do this new treatment? What's important is it's open two-way communication with your medical team to help you make those decisions. You don't have to make them on your own.
We met as a team, we met with the genetics people, and yeah, they gave us a lot of, as best information as they could. And that's been developing as we've gone along. Initially, you feel completely isolated and frightened, obviously, but once you are connected with the right people and the right medical team and whatnot, it does bring a lot of comfort. A motivation to then move forward and find more information and do everything you can in your power to help your child.
And so never be afraid to ask questions, and I have learnt that as a mum on the journey. And you know, knowledge is power.
Your doctors are always here to support and guide you. However, this series of videos is designed to inform you upfront, as ultimately this is a decision that you must make for your child. As you go through your journey, always remember to ask for support early on. Make the time to take care of yourself. Ask yourself what tools you need to make an informed decision. Stay engaged with your medical team and continue to provide a caring and supportive environment for your child. And do your best to not become overwhelmed with information. Instead, focus on what works best for you so you can concentrate on what's most important and what things you want to know more about. More information on stem cell therapy can be found on our website.